Hi, I'm Shay Smith, and the technology I decided to do my project on is the ultrasonic instrumentation. I have my Typodont here, but of course if I were using a real person, I would have a mask, I'd have gloves on, full PPE. So the reason why I chose the ultrasonic, especially for us dental hygienists, is because we're going to be using this every single day that we see a patient, and it really does help with the initial debridement, removing the bacteria both on the tooth and below the gum line. That's sometimes hard to get at with our regular scalers that we use. So this is our ultrasonic machine, and so you'll turn it on. Not all look the same. This one's a little bit older of a model, and so these will light up. When you first start using it in the morning, you'll purge the lines, so it'll run water through to get out any bacteria that might have been sitting in the lines overnight. And then the turbo button's used in some circumstances where biofilm or plaque calculus is hard to remove. We have the dial. Most of the time we try and keep it pretty low, maybe around the 9 o'clock position, and it can go a little higher depending on the insert you can use. I'm using a slimline thin cert, so this one can go up even higher than the 12 o'clock position. So what you would do with this one, it uses water and vibrations to help break apart the plaque and bacteria that's either on the tooth or below the gum line. So it creates just little tiny bubbles or cavitations to help break that apart. And so if you look, I have my little Typodont, and you would just have it on the surface right here of the tooth, and you'd make sure to go back and forth overlapping strokes, and you'd want to get under the gingival margin and just make sure it's nice sweeping motions. Don't want to stay on one surface too long, and you also don't want to have it pointed towards the tooth because that's where you do most of the damage. So I like this piece of technology because it does really make our lives a lot easier as hygienists, and it's something that I feel like will only get better with time, different technologies that we'll use, and it helps to really get rid of the bacteria that's under the sulcus that's causing a lot of the inflammation that patients either see or they have chief concerns of pain, and it helps to flush out the pocket and create a nice lavage. So there's my instrumentation. See you guys around.